Hello everyone and welcome to Blood and Hematology YouTube channel. This video is about reticulocyte indices. Reticulocyte percentage, with a reference interval of 1 to 2% in adults, indicates the rate of erythrocytes turnover and represents the daily replacement of 0.8 to 1% of the circulating red blood cells. Hematology analyzers can count reticulocytes and quantify their maturity with fluorescence flow cytometry, using a specific fluorescence marker which labels nucleic acids and other components of reticulocytes. The intensity of the resulting fluorescence signal is directly proportional to the nucleic acid content. Reticulocytes emit a higher fluorescence signal than mature erythrocytes. According to fluorescence intensity, reticulocytes are fractionated into three categories: low, medium and high fluorescence fractions. Immature reticulocyte fraction reflects the proportion of immature reticulocytes and is calculated from the sum of medium plus high fluorescence fractions. The immature reticulocyte fraction is an early and sensitive index of erythropoietic activity of the bone marrow, and with the reticulocyte count, can be used to distinguish types of anemias and assessing efficacy of anemia therapy, evaluating bone marrow suppression during chemotherapy, monitoring hematopoietic regeneration after bone marrow or stem cell transplantation, and monitoring renal transplant engraftment. Mean reticulocyte volume is 24% higher than the mean cell volume of mature erythrocytes. The MRV multiplied by the number of reticulocytes gives the hematocrit value of the reticulocytes. The MRV is a sensitive marker of erythropoiesis and can be used to monitoring of treatment response. Comparison of reticulocyte indexes in megaloblastic anemia, chronic kidney disease and myelodysplastic syndrome cases. Each cell is plotted in the reticulocyte scattergram based on its fluorescence intensity, x-axis, and its high-angle forward scattered light signal, y-axis, which reflects characteristics of both cell size and cellular content. Estimates of reticulocyte-specific hemoglobin content by light scatter measurements of reticulocytes provides an assessment of the availability of iron for erythropoiesis. The reticulocyte hemoglobin is useful to detect early iron deficiency, and also functional iron deficiency in complex clinical settings, such as chronic inflammation and chronic renal disease. The parameter delta hemoglobin reflects the difference between the hemoglobin equivalent of reticulocytes and the hemoglobin content of mature erythrocytes, measured in the reticulocyte channel in Sysmex XN and XNL series analyzers. Under physiological conditions, the delta hemoglobin value is positive, since the hemoglobin content in reticulocytes is higher than in mature red blood cells. Negative delta hemoglobin values are resulted from lower hemoglobinization degree in newly formed reticulocytes compared to mature erythrocytes. The parameter delta hemoglobin can measure intracellular iron deficiency in a highly sensitive and accurate way. Hypo and hyperhemoglobinized erythrocytes are parameters analyzed in the reticulocyte channel on Sysmex XN class analyzers. They are derived from the hemoglobin content of all mature red cells, which can be calculated based on the high-angle forward scatter. The forward scatter signal is converted into picograms, and in healthy individuals, the resulting hemoglobin content value is comparable to the mean cell hemoglobin value. Hypohemoglobinized is the percentage of erythrocytes with cellular hemoglobin content lower than 17 picograms, whereas hyperhemoglobinized is the percentage of erythrocytes with cellular hemoglobin content higher than 49 picograms. The left panel of the figure shows a sample from a healthy individual with hypohemoglobinized erythrocytes less than 1%, and the right panel shows a sample with hypohemoglobinized erythrocytes more than 60%. Thank you for watching this video. If you liked this video, to give it a thumbs up and share it. Do not forget to subscribe to the channel, if you still have not. You can click on the bell to receive notifications whenever a new video is uploaded.